Welcome to Leveraging the Laboratory, a Mayo Clinic Laboratories podcast for administrators, outreach managers, and laboratory professionals to learn how to best leverage and optimize the laboratory for patients, clients, and staff. I'm your host, Jane Hermansen, Outreach Manager at Mayo Clinic Laboratories. Joining me today are our perennial favorite guests, Dijkman Dulkes and Brianne Newton, who are Outreach Solution Strategists within Mayo Clinic Laboratories. Our discussion topic today is customer service. A core element of any successful outreach program is providing excellent customer service. And we all know bad service when we see it. But what exactly is good customer service, and especially what is good service in the context of an outreach program? We're going to work through that over the next few minutes today. So we're going to start with a good question for Ellen. Ellen, when you think about your own healthcare decisions, how does customer service impact or influence you in making a choice in your provider?
Well, I think it's everything, Jane. It's how it makes me feel. It's how I interact with that healthcare provider. It's from the minute I engage with the team to make an appointment. It's how long it makes that appointment ready for me if I have to wait months and months. It's if their person has a smile in their voice when they talk to me. It's, the price, the quality, and the service. I expect that. But it's really, do they know me? If I have to call them and every time they're like, oh, they don't know my name. Ellen Dijkman Dulkes is a hard name to say, but I wear them down that they know it the next time I call, and they're like, oh, Ellen, they don't even use my last name, but then they know a little bit about me and my family. They want to know about me, and they make things right when things go wrong, and they listen to me and they empathize. When I have an urgency, they hear it in my voice, and they hear what I don't say, and they read between the lines, and that is what I find really helpful.
So what I hear you saying, it's really that familiarity and the kind of the compassion that you're treated with. So that certainly is going to keep me coming back. So Brianne, from your perspective, certainly you've been a healthcare consumer in the past. Would you like to share an example of a healthcare customer service experience, one that's good or bad, that influenced your choice in a care provider?
Sure, yeah. A good or bad experience. That's kind of
Either one,
daunting.
pick one.
Pick one.
Pick two.
I'll pick the good experience because that is more warm and fuzzy. So when my daughter was younger, she had a sports related injury and we weren't exactly sure the extent of it. And we went to our primary care physician and then were referred then to a specialty practitioner for pediatric injuries. And just the feel of that environment walking in, and it's a specialty practice, so they know their audience and they know their patient demographic, but it was so startling to see the difference between just run-of-the-mill, ordinary acute care hospital setting and then stepping into that. And I really tried to take note while we were there, what was different. And it was just, you could imagine the decor on the walls to the items available in the waiting room to even just how the staff interacted with their patients, which in case, wasn't me, it was my daughter. And so, crouching down to get on her eye level, asking questions that she would understand. At the time, my daughter's age, she was old enough to know she was capable of answering her own questions. And you can imagine, just the same as us, we don't want to be in a room and be talked about. We would like to be talked to. And so the questions and the information that they could get from her, they got from her. And it kind of empowered her to begin her healthcare journey to take part in her own care. And so that was really important to her. And then me as the mom, just being full of anxiety, being full of concern on what was going to happen, and how my daughter would react to whatever the news was or the treatment was. They did a really good job of also addressing the caregiver needs, which in that case was me. And so just really helped us feel a lot more calm and a lot more secure in their care as we went through the journey to get her better.
And Brianne, I would add that, I'm at the other end of life. You've got a younger daughter, but I'm helping to take care of my mother. And similarly, that caregiver, how they help me with my mother, and she's challenged. And so I think it's both ends. Helping the caregiver is incredibly important.
Truly. And I think when you think about caring for a patient, you're not just caring for the patient, it's the entire family and anyone who's with them. So that's fantastic. And I'm really proud of you guys. Nobody mentioned a negative experience. We're keeping it positive today, right? But I'm sure you all know when you have a negative experience, you have strong emotions, you remember it a lot. And when you're in a service industry, which ultimately an outreach program is, a single bad experience can really be enough to prevent you from ever doing business with that organization ever again. And likewise, a great experience can create a lifetime of loyalty. Now, of course, Brianne, in your example, a pediatric practice, your children have outgrown that, so they don't get to go there anymore. But during that time, you certainly would have gone back if you needed to. So when we switch gears now and we think about an outreach program specifically, let's think about the people that deliver service and how they deliver service to our customers. And the way that each person interacts with a customer is across the whole kind of cycle of service for that patient or for that customer. And that concept is called points of contact. So we'll start with you, Brianne. When you think about a physician outreach customer, what are the points of contact across that cycle of service for that customer? What do you think?
I think there's a lot of opportunity to do things really well or to really screw it up. Because there is so many individual points, like you talked about touch points. Um, I would even say it starts before they're your customer. And it's the initial contact made, whether that be they're contacting you, requesting your services, or you have a sales initiative in your within your laboratory, some sales activity that goes out and finds the business. But it is the customer service journey with that client, I think, begins even then. And so it can be the initial kind of recruiting of the client, if you will, and then onboarding them through your processes and getting them used to your system or whatever the uh, the flavor of that might be. But and then you go through, and it is whether you're providing a phlebotomist on site, and it's the training and the expertise and everything of that phlebotomist, or it could be their introduction to your patient service centers when they send patients your direction. How do you take care of them? So just handling their business, if you will, and then when there's a question or when there's an issue, you kind of have that second layer where they actually reach out with a problem. How do you handle that? So it's the troubleshooting or it's the answering questions. And then we go through the actual results, criticals notification, and then we have billing. So every touch point, not only of handling the relationship with that patient, but now you're adding on the life cycle of the specimen, both just start to finish, A to Z. But in my heart, I believe it really begins way before they're your client in actually helping them feel secure in the relationship that you are going to take care of them and do a good job.
Absolutely. Well, and I like how you indicated that there are different people that are going to be responsible for each of those, and truly customer service is delivered by the individuals. All right, Ellen, if you think about it being a patient instead of a physician office, what are the points of contact that are different when you think of a patient experience related to the outreach program?
Yeah, well, if you think that patients have a choice, and they do, of where they go for their lab draw or for their specimen collection, where they go to see a provider and where that provider sends the specimen, patient has a choice. And sometimes we don't often see that the patient has a choice when we're just looking at specimens. And so the patient experience really starts when the patient gets out of bed in the morning. And I like the analogy of them walking out of the room with a full cup of water. They have a great day ahead of them. They get a full cup of water. And every time they make an appointment for a visit, and maybe that appointment isn't good, they lose a little bit of that cup of water. They lose a little water. And then they go to the lab and they can't find parking. And they drive around and they drive around and they drive around. They lose a little bit more of that water in their cup. And then they go to the waiting room, or actually, they try to find the waiting room, and there's no signage, and there's no wayfinding, and there's no wheelchairs. They lose some more of that water, right? Then they go to the waiting room, and there's a long line, and they have to get to registration. Well, they lose a little bit more water, and then they're sitting there, and they see patients that go ahead of them when they got there, and no one explains to them that their orders aren't in the system and they have to call their provider that doesn't open till 9, but it's 7 in the morning. They lose some more water. So by the time your phlebotomist calls that patient, their cup is empty and they have just had it. And the poor lab person is like, what did I do wrong? I just called you. I got the order. I'm calling you. But they don't realize that the patient experience started when they started to have a great day. I'm going to go to the lab to have my blood drawn. And then it just goes to heck in a handbasket and they lose it. So we have to really understand that patients have a choice. And maybe the next time they say, I'm trying a different lab because it was just too much hassle and they ruined my day.
So I think what you just identified are some things that are out of control of the laboratory. It could be some of these other things are really part of the organization and it doesn't have anything to do with it, but it certainly is shaping that patient's perspective and giving them an impression of that organization. Are there any things that either of you can think about that would be different when you think about serving different aspects of customers, such as hospital, skilled nursing facility, going to a retirement facility, for example, anything different that would shape the service impression for a customer in those environments?
Yeah, I would just say it's probably billing and resulting. And, maybe they collect their own blood or they have a phlebotomy service that draws the blood, but skilled nursing and they're going to rely on results. Are they able to get the results as fast as they can to treat that patient? How is it easy do they get called when a test is canceled or a critical result? Those are the service kinds of things because they have a critical population. I would think that would be a difference in the service that they get from their laboratory.
Brianne's nodding her head, but she's not talking. So I just had one other thought is that one thing that I didn't hear about was the courier. And I think that the courier could be a fantastic representative of the laboratory, either positive or negative based on dress,
And I
behavior.
did that consciously, Jane, because the courier gets blamed for so much.
Yeah.
And I didn't want to throw the courier under the bus, but that's the first place that I hear most often that gets blamed for all the failures in service. Courier didn't pick up the specimen. Courier lost the specimen. Courier did this. Courier did that. And I didn't want to mention that today.
Well, so I just think it's not just that, but it's really how their behavior is. And do they have positive and effective behavior? And I think those are all important things, but then the telephone, the bill, even how the result is formatted, each of these things creates a perception. Okay, so we've talked about customers, we've talked about just service overall. Let's talk about the employees because that's where service is actually delivered. I'm going to start with you, Ellen. You're a manager of people who are doing customer service. What can you do as a manager to ensure that your employees are doing their part?
I think you need to create a culture of service when you train a new employee. If you see something, do something, whether it's helping a patient put on a coat and help them take off their coat. I've been to have many draws with my mother and no one offers to help her with her coat. Where do you put your handbag? Where do you put those kind of things? They're so focused on the tubes and getting the procedure done that we don't use those extra steps to help them with their other essentials. They label their tube, they're ready to move on to the next patient. We don't help them put on their coat and show them to the door. Professionalism. We hire many entry-level positions. What does professionalism mean? What does it mean to be professional? What do you mean I can't chew gum? And what do you mean, why do I have to look presentable? And what does it mean to look presentable? And most organizations have a policy on what that looks like. I think orientation needs to focus on what an outreach customer is and why they are so important. We're so focused on dealing with the patient, but I don't think we do a good job teaching that an outreach customer has a choice and that we are a service industry and we need to retain customers. We need to retain patients. Training. I often have new hires go and sit in the waiting room and I have them use those experiences as part of a lunch and learn, perhaps. In fact, one example I had in my own experience with my mother is there was a bariatric chair who had the chair legs were like leaning in, like it really was falling apart. And I said something to the registrar, and she's like, "Oh, it's fine, it's fine." Well, imagine my horror if somebody sat in that chair, anybody sat in that chair, a mother and their kids, or a larger person, and they fell on the floor. I would be mortified if it happened to me. And so I happened to know the lab person in the back, the team leader, and I sent them a note and said, "Hey, check the chair in the waiting room." And she's like, "Oh my gosh, I had brought that to their attention. I thought it got fixed, but how many people wouldn't say anything and it would have been a horrific event? So please, empower your staff, say something, do something. And then when somebody does bring it to your attention, do something. So I think that's important.
Awesome. Awesome. Thank you. So really from your perspective, just setting the employees up to be successful and then creating an environment externally for the patient experience as well. Brianne, how about you as a manager, now that you've got the people in place, you've got the culture, you got the job description, you've trained them, how do you ensure effectiveness in your staff providing good customer service, and how do you measure that success?
That's a good question. I think the first is piggybacking off of what Ellen said, is you've created a culture of this. Let's make that an assumption, a culture of customer service. But effective customer service, I think it's you as the leader. It's up to you to provide what that looks like and to model what that looks like. So I say first is sharing your vision of what the expectations are, setting standards for what effective customer service would look like, and the expectations on your staff to do it, to provide it. And then I would second that with talking to your staff and surveying, questioning, having open dialogue with them on, okay, now that I've told you what we're gonna do, how we're gonna get there, what tools do you need to arrive there, to make that easier? What am I asking you to do that's harder than it should be? And then working within what you can to provide those tools for your employees. And then last is, set goals related to the effectiveness of your customer service in a way that is measurable. We talk about SMART goals all the time, and one of those is that it's specific and it's measurable. And so say, okay, do we want this certain score to go up, or this certain wait time to go down, or whatever that is, the number of complaints, whatever category you want to put it in, but make it measurable so that you can actually capture data and then report back to your staff and let them know how we're doing. Maybe we put something new in place. Maybe we've changed the way we're doing something. Provide that feedback to your staff and say, okay, that didn't work. What can we do next? Or, hey, guys, that was a great idea. And then last, above all, I would say is as the leader, don't assume you're responsible for every good idea that comes from the lab, or every good idea of how things should be done. In that cycle of reporting back and providing feedback, say, okay, that worked great. How can we make it better? Team, what do you think? Or, ooh, that didn't that didn't go well. Does anybody have any ideas on what maybe we could try next time? And so don't feel like you're carrying the burden of trying to come up with all of your great customer service ways and methods all by yourself. Keep your team involved.
Absolutely. Well, they're the ones doing the work, so they will likely have an idea of how you can make it easier for them. So fantastic. So we've talked a lot here now about the frontline staff, and these are the staff that your patients, your customers are interacting with directly. How about staff that are behind the scenes and may never see a patient or a customer? Is it feasible that there should be anyone in the laboratory that's not involved in providing customer service? Brianne, how do you feel about that?
I love that question. It is hard to convince someone who sits in the corner of the laboratory and never talks to anybody that they are part of a patient's experience or a specimen's journey, or part of what we're talking about. I don't need to provide customer service. I don't see our customers. And but in order to create that culture we were talking about, yes, they actually do, in fact. And I wholeheartedly believe this. There's not a corner of the lab that customer service doesn't touch. And it is a little shift in the dynamic, though. For the person sitting at the scope in the corner of the lab, your customer service may not be to the patient or to the office or to the location or wherever that order originated, but your customer service is actually to internal customers. You're helping the people that help the clients. You're helping the people that help the customers. And so imagine a patient or a provider calls in with a question, or they're upset, or they have a certain urgency or whatever. The call center then needs to pick up to a tech in a section. That's you. You provide the timely answers. You provide the troubleshooting or whatever that might be. So the person in the call center can then make contact with the provider and make it all right. And so, no, it doesn't look the same, but it's every bit as important. And it continues to foster that internal culture of, hey guys, we're all in this together. We're all helping the patients together. The story just looks a little bit different.
Absolutely. Well, and every single individual has a role, right? And Ellen, I remember you telling a story just kind of about your own transformation, how you went from a blood bank tech without a customer service attitude. Maybe you want to share that story today.
Oh no, oh
I
no,
remember
no.
everything you tell me. You know that.
Oh no, Brianne set this up. So yeah, I was a blood banker right out of med tech school, and blood bank, it's fast and furious and I didn't know. So in blood bank, you're a little right angled in blood bank and you got to have everything just right. And I was a great blood banker. I really was, but I had the personality of you know what. And they would call the lab and I would answer the phone, lab. Thursday. I would have written myself up if I am who I am now, lab. And then they would ask for 2 units. Can I have 2 units? I'd say name. They'd have to give me the patient name. And they would say, and then they give me the medical record number. I don't have the medical record number. Well, they can't have the blood. Need name and medical record number. I'll hold. I'll wait till you get it. I was not very nice, Jane. I was not very nice. And I remember it clear as day, lab. And I would get the blood. I was incredibly technically strong, but I was not that person that was customer service friendly. And I don't know, I've evolved in my 30 something years. And I think in hindsight, my younger self, I would have coached. And I've evolved, and thank heavens we do, because I'm not proud of how I answered that phone. So on behalf of Blood Bank where I used to work, I'm very sorry how I answered the phone.
But you're better now. She's
I
better
am
now.
better now.
All right.
So be the person you want to be, not who you were. So
Fantastic. So truly, each of those things, though, Ellen, you were ensuring quality. Brianne, you talked about the person who's at the scope. So we want to make sure you're managing, of course, the analytic quality, the pre and post analytic quality on the sessioning and the data entry staff, providing good turnaround time. All of those things are non-people skills, but they all really are attached to providing a great service for that customer. And of course, we know customer service, if you just say, hey, go provide great service, and people are going, we don't even have the staff to keep the wheels on the bus today. What do you mean? Of course, we need to make sure that you have adequate staff in place to perform the service. That's our role as leaders and managers, to make sure we do have the right staff. And then we need to provide a work environment that is as low stress as possible. No, you can't remove stress. Whenever you're dealing with people, though, that stress increases. So how do you provide an environment that's not stressful? And all of those things take time, effort, perhaps some resources, but is it worth doing? Yeah, it's worth doing. And I just came across this week. Recent studies show that 2/3 of customers who've had a positive customer service experience, they view that as more important than price. 2/3 of customers value service over price. And 9 of 10 people who've had a positive experience have brand loyalty. That's repeat business. And when there's a negative experience, only 18% have brand loyalty. And those people are out there bad-mouthing your organization. So if you provide great customer service, it's truly going to provide great dividends. So let's bring this discussion to a close with our famous rapid fire question. We'll start with Ellen. I want you to name 2 or 3 things that you feel are most important to delivering excellent customer service. Ready, set, go.
smile and be genuine. And I like to make the world a better place by doing something to help someone else in real time. In fact, I even give out smiley pins to servers when I go to a restaurant. Even if the service is lousy, if my server is exceptional and I know they're feeling bad, I give them a smiley pin. And lastly, I keep track of those things that are broken so we can fix it.
Perfect. Brianne, how about you? Your top 2 or 3?
First is the experience. Remember that all of us are patients at one point in time or another. And so either keeping a negative experience you may have had at the forefront so that when you're providing customer service, it's as far away from that experience that you've had as possible. So making it the polar opposite and doing everything you can, but remembering what it feels like to be a patient and what it feels like to have someone go above and beyond and how wonderful that is. And then the second one I would even say would be going back to the training that Ellen mentioned, having tools, having resources, having training. That we do have one that our clients and others can take advantage of, and that is customer service training modules. It's available on our website. We have credit that you can earn or your staff can earn, and some use it in an onboarding activity. Some use it as continual, annual, just to keep everything fresh. And so I would say stuff like that. Create your own, use ours, tweak it, but always have some sort of training so that the expectation is there, but also that it doesn't become part of a routine day and something that you could, easily step away from. You've got the training, you've got the tools. Let's make it happen.
Perfect. Well, I think our audience can probably tell we're a little bit passionate about customer service. We have filled our time today, and I think that we could talk about this really for hours. But Brianne, Ellen, thank you so much. So just as a recap, we've talked about how important customer service is to an outreach program and the role that each employee plays in delivering that service. It certainly is a journey. No employee is off limits. Everybody can actually play and contribute to providing great customer service. So our request for you is go out and provide some great service on your own. And thank you today for listening to our Leveraging the Laboratory podcast from Mayo Clinic Laboratories. If you've enjoyed this podcast, please subscribe. And until next time, we encourage you to continue to promote your community-based hospital laboratory. The needs of the patient come first.